Hello, future nurses, and welcome back to this video lecture series. Again, we're talking about key areas of responsibilities, the core competencies of nursing, and we're on number three, which is health education. As we all know, health education is one of the basic responsibilities of a health practitioner, including that of a nurse. And according to the symbol, this key area of responsibility includes assessing the educational needs of your clients, of the patient, their families, and developing health education plans and materials, and also to evaluate the outcome of your education which you have provided. Okay, so here are the following core competencies and indicators under this key area of responsibility. So number one, uh, always we should assess the learning needs of the patient and their families, and is indicated the indicators are the following: obtains learning information through interview, observation, so and validation. So you're assessing if your clients um, at least know something about their problems or their situation or their condition, and you provide uh, relevant information regarding their situation, their condition, and you record also the assessment. Okay, sometimes these are the things that are not documented, although they are corrected. But in nursing, we should not also forget to document the health teachings that you are providing to your clients. Then you identify priority needs. Then number two, develop health education plan based on the assessed and anticipated needs. Okay, it's like you're following your nursing care process also. That's the very framework of our practice. Follow your nursing care process. You assess, you plan until you evaluate. Okay. Um, on planning, you consider the nature of the learner, the characteristics of the learner, the level of knowledge, uh, um, and other factors like you can also consider their religion, their race, their it depends on the situation, depends on the condition, on the information that you're going to give. Yes, you can consider their age, gender, socioeconomic status, level of education. Okay, so these are factors to be considered. Okay, so for you to know how are you going to go about your health education, especially in the actual scenario already. So these are to be planned out. Then number three, develops a learning material for health education. Okay, so after you have assessed, you have planned, especially in planning, you must consider your materials. Okay, what are the things you need? What are the factors to consider? Okay, so we have here in your planning, one of your priorities is how you are going to involve the patient, how you are going to involve your client, your the client's family. Okay, formulate a comprehensive health educational plan with the following components: objectives, content, time, and allotment. If you are familiar with this, you come up with a session design, a teaching plan, okay, which bears the following: your objective, your um, your content. When you say content, what are the topics that you're going to discuss? The time, how many minutes are you going to allot with this discussion, this topic? Remember, we should be smart. We should be time bound. The actions that we are doing should be time bound. Okay, because time is of the essence. Okay, teaching, learning resources, and evaluation parameters. So, what are the things that are the resources that you need? How are you going to evaluate, okay, the learning aspect of your client, and provide feedback to finalize the plan? Okay, so feedback is very important. You should consider this always in planning. Okay, you can ask feedbacks from maybe with your colleagues, to your client, family, to the client's family, okay, and to those maybe your heads as nurses or your instructors as students, okay. So to improve, okay, your planning, to improve the actual scenario later on. Then number four, implement the health education plan. Okay, so this is the actual setting, the actual experience already. Okay, provide for conducive learning situation in terms of time and place. You consider it. Um, Consider the client and family preparedness or the readiness. Okay, to utilize a strategy. Expect uh, that the client will not immediately accept, okay, or practice what you teach, as we say. It's a gradual process, especially if the condition, the 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 concern is in the, as we say, system of the person. Okay, make it gradual. Okay, gradual learning, cooperative learning, but gradual learning. Okay, and the challenge also here is when we are talking about, for example, is healthy living. As an educator or the nurse, you're expected to model it, to be an example, to practice what you preach, as we say. Okay? So, provides reassuring presence through active listening, touch, okay? Therapeutic touch, uh, facial expressions, and gestures. Okay? Remember that as an educator, as a teacher, um, the best visual aid is you. Okay? It's you. And monitor client and family responses to health education. You can do that. And one more thing in the actual health education session is you always consider, especially if the client is adult, you also consider the experience of the client. Okay? Experience, if one, if they have already experienced the situation, the condition before. And number two, experience in terms of how can they apply this in their experiences later, how can they apply this in their everyday life, because that is one of the important things to consider for them to accept what you are teaching. If they see that this is very applicable, it has good benefits in their day-to-day life, high chances is that they will accept and do, okay, what you are teaching. The degree of persuasion, of influence is high. Okay, remember I use the word persuasion and influence. I'm not using the word coercion. Okay, do not force them, and most especially is respect them. Okay, respect their beliefs, their practices, but prioritize safety, prioritize what is scientific. And then number five, evaluate the outcome of health education. Okay, as always, the end of our nursing process is evaluation. Okay, know if um, the plan, the, the the plan, the actual setting is successful. Okay, if not, revise. Okay, revise when necessary. Okay, as stated in number five, evaluate the outcome of health education. Utilize evaluation parameters, document outcome of care, revises health education plan when necessary. Okay, so I just want to emphasize here the second statement, document. Okay, it's always important that what you do to your patient is you write it down, you document it. As ISO would say, okay, the National Organization for Standardization, write what you do and do what you write. Okay, unwritten or undocumented interventions are considered to be undone. Okay, so you document always. So that is our key area of responsibility, health education. Okay? Very simple. And I hope you will be practicing this one and be having that confidence when you're in front of your patient later on, when you start your RLEs, when you're in front of your patient. So one of your interventions there is health education. Though it's in formal setting, the health teachings you're giving is already considered to be a health education. Okay? So have that confidence in you. You'll be a future nurse. Okay? So see you in the next key area of responsibility in the next video lecture. Thank you. This is again Sir Emil, your online nurse educator. ONE 1. Thank you.